Thank you, Courtney. And I'm going to try to figure out how this works, actually. Okay. So, thanks to the Rockefeller Institute to have us here today to talk about long-term care. I'm shocked and amazed that on a Monday morning, a snowy Monday morning, we have this many people in the room, and thanks for that. We'll try to entertain you for a little bit. And more importantly, I want you to ask as many questions as you can think of and try to fool us, actually. So paying for long-term care. Well, what is long-term care in New York? It's a variety of things. The most important thing that you have to know about long-term care is actually it's non-governmental. It's helping your neighbor, helping your family, helping your friend. The vast majority of long-term care expense in this state and in this country is the informal family caregiving network or system. So it's things like checking up on your grandmother who has a slight case of dementia and making sure that she can stay in her home, like calling her every couple days, or going over and preparing meals. It's things like home care, non-medical assistance. So the Meals on Wheels system, the non-medical assistance that people give in the home all the time. Then you get into, as the gradations go, community-based assistance. So that's our personal care program in New York State, our ISIP program, home care, all the community-based assistance that we have, a vast majority of it. I'll go to that later. Then if someone can't live in their home, then you have the residential options, which are assisted living, adult home, or congregate level senior housing. Finally have the nursing home level of care, which is a very extensive system in New York, very expensive, and one of the best systems in the country. So long-term care is a lot of things to a lot of different people, basically. But that's kind of the variety of sources and supports. Who pays for long-term care? It's about $500 billion annually, $40 billion in New York. $40 billion now. That's not all government. The majority of it is the informal caregiving system. Medicaid. Now, we're going to get into discussions about numbers here. The numbers vary depending on the data source, but we have the numbers about $12.4 billion. That's Medicaid long-term care, non-OMRDD expenditures. So we spend about $12.4 billion, about $6 billion on home care, about $6 or $7 billion on nursing home care. So $6 billion on home and community-based care is by far the most extensive investment any state does in home and community-based care. We should be proud of that. We also spend over $6 billion on nursing home cares. Again, one of the biggest investments of any state. And again, my point I want to leave you with this slide is that $20 billion of it, at least $20 billion, is the informal or caregiving system, which we need to invest in and preserve. What is the informal caregiving system? Of those receiving care, 65%, age 75, 29%, 85. As people age and live older in their lives, that system needs to be preserved. About 13% of the adults in New York State are caregivers. So 13% of the probably people in this room as well are doing caregiving duties for someone who needs long-term care. An average of 13 hours a week, valued about $20 billion. We don't even count the cost of the lost work hours that are gone into people who are caregivers. That's just the value of the care that they provide. Compared to New York State, compared to U.S., New York State provides more care at the lower levels, which is a great thing. And basically, those who need care are people that need care because of their aging. Dementia is an important topic that you'll hear throughout today's presentations. But those who need care really is because people are getting older. And then those who need care, the highest level of care are the people who suffer from major chronic or major diseases. So as the chronic disease phenomenon ages through the process, we're going to need higher levels of care. That's why it's important to invest in the chronic disease prevention efforts at the lowest level of the age spectrum, and also in the middle and the upper age levels of the spectrum. So 27% of Medicaid spending is on long-term care. Now this is a chart which I always have difficulty reading because it's colors, and I'm a little bit colorblind. So let me just kind of walk you through it. So that's nursing home care, 51%. Then you go through the long-term home health care program. Great New York State waiver back to the early 80s, about 20,000 people in there. Then the other adult daycare out programs, managed long-term care, which is really a phenomenon since 1997, personal care, and home care. Now, when I talk about home care, I want to talk a little bit about the long-term care aspect of home care. If you have an elderly woman, usually falls down, breaks her hip, goes to the hospital, is in the hospital for a couple of days, comes out and gets home care to transition her back into activities of daily living, that first period of home care, I don't consider long-term care. I consider that a post-acute type episode in the home. So this 11% has that in that, but it also has a lot of home care that's delivered in New York past that 60 or 120 days. So that's kind of how the system lays out. It's still dependent on nursing homes, still 51% nursing homes. However, 49% is a lot of home and community-based options. So how much does this stuff really cost? So I had my staff, actually last week, start calling people. Random survey, calling people and calling providers. My grandmother needs nursing home care. How much does it cost? My grandmother needs assisted living. How much does it cost? So this is kind of what we got. In the capital region, it costs about $45,000 to $74,000 a year. So downstate, it costs about $64,000 to $82,000 a year. That's assisted living. So that means a wide variety of things. That means places like Delmar Place in Delmar, which I walk by every day. It is a great assisted living place, but they charge for services on top of that $45,000 or $74,000 a year. So assisted living means a lot of different things to a lot of different people, but it's really a residential option for people who aren't nursing home eligible. And it costs about $50,000, $60,000 a year. Home health care. Now this is a wide variation as well. You see here that in the capital region it costs about $24 an hour. In New York City is $19.50 an hour. Now that's for aides, for home health aides, helping you do the things that you do in a normal daily living. So getting up, going to the bathroom, dressing yourself, some sort of just activities of daily living. And it costs less in New York City, mostly because the supply of labor is tremendous in New York City compared to upstate. So $24 an hour, as you see, can rack it up pretty fast. Nursing home level of care. Now, again, this is just staff called last week and said, how much does it cost? Private pay. New York City's about $100,000 to $140,000 a year. Long Island, $130,000 to $160,000. Capital Region, about $100,000 to $140,000. So these are private rooms. You can get a better deal if you're semi-private, but that's really the cost. So it's basically $100,000 to $150,000 a year. And, that's the real cost. Just how much does it cost to pay for long-term care? So if you need a nursing home in this state, which a lot of people are going to need to stay there, and you go into a nursing home, the average length of stay is about 2.5 years. Now that number fluctuates up and down, and that number has dramatically decreased in the last couple of years because of all the short stays in nursing homes, the Medicare stays, people cycling from hospital to nursing home and then home. But for those entering an upstate in 2008, that's the cost of your nursing home stay. $262,000, New York Metro, $335,000. Then, assuming the cost inflation is 5.5% a year, in 2036, now that seems like a long time from now. I mean, it is, but we're talking million and $1.3 million. Now, New York City includes Nassau, Suffolk. These are just stats that we pulled off. But any way you cut it, $1 million, $1.3 million, or even these numbers, these are large numbers that people have to deal with. The system, society has to deal with over time. So I always make this analogy, and sometimes it's lost on people, but I'll try with this group. So what's another big expense that people plan for when they have children is college tuition. So college tuition at a public university costs about $60,000 a year. Now go back to nursing home level of care stage, 262. Let's use upstate, 262,000. And then you go to college tuition, it's about $60,000. And if you go to a private school, it costs about $142,000. And this includes room and board as well. So the comparison I'm trying to make is $142,000 or $60,000, depending where you go to college, and $262,000. Now, we have all these things how parents to plan for college. We have college savings accounts. We have all this. We have the TAP program. We have all these college loans and scholarships. And the cultural norm is to plan for when you have a child to start planning for college. So we have all sorts of things to do that. We also have government supports to help finance college, the SUNY system, the CUNY system, all the supports that we've done. But on long-term care, because no one really wants to think about, most don't plan for potential need, and government supports are few, unless you talk about the Medicaid system. The Medicaid system, or spend down, is really where the government comes in. So we don't really plan for long-term care. We just assume that the government will be there to pay for it if we ever need it, which is exactly the wrong way to approach it. So in New York State, let me just get a little bit off track, we of course are very generous in our Medicaid system, and we have many things that's set up to help people in need. We have things such as spousal refusal, and we take the highest options on community support spouse resource allowance. That's a tongue twister for one thing. It also is a really complicated way to say that New York State has took back in 1989 and continues to take all the options that are available to them to help keep couples in the home and help allow them to save as much money as they can while they're on the Medicaid system. Spousal refusal is a classic public policy debate that's been going on for at least 20 years, 22 years, I think, where we have a provision in the social services law which allows the spouse to refuse to contribute to the cost of care of the other spouse. Now, why would we do that? Why would we allow that? Why would we allow one spouse to refuse to contribute to the cost of care? And every executive back to Mario Cuomo, George Pataki, Elliot Spitzer, I don't think David Patterson tried, but has tried to eliminate this and has failed with the legislature, because the legislature and the people who elect them have decided that the spousal refusal provision is something that we should have, because there's couples and situations that need to be able to retain as much income as possible to remain in a home. We also have this cultural norm that's going on here in society, and in New York especially, is paying for long-term care versus passing on wealth through the generations. Now, I tried to find a really funny slide or a cartoon to show the first bullet, and I came up empty. So you'll see very just plain words on a piece of paper. But I said that what I'm trying to say here is the American experience really is to pass on wealth to the generations. You want your kids to be better off than you are. And what's happening is that as long-term care sometimes forces the choice for families whether you should pay for your long-term care bill or leave a legacy financially to your family. And that's a hard choice for people to make. And it's something that society must come to terms with over time. So leading into the partnership program, which Courtney mentioned a little bit, is one of the options that we have. The New York State Partnership Program was started by Robert Wood Johnson grant back in 1989 in a law that was passed, which was the partnership. It allows people to buy long-term care insurance and have full asset protection if they run through the insurance, or dollar for dollar asset protection, which was added later in 2005, or 4 or 5 or 6, I think. So it's a combination of private insurance and Medicaid extended coverage. So it's kind of a deal. We'll say to you, if you buy insurance, pay for insurance, and then use the insurance throughout the policy, Medicaid will be there for you at the end with no look at your assets. Developed in the late 80s, 4 states, New York, California, Connecticut, Indiana. Sold the first policies in 93. There were changes in the Federal Deficit Reduction Act of 2005, expansion of the partnership program nationwide, hopefully, and changes in the Medicaid long-term care eligibility. So the partnership program really is one of our signature programs to help people plan for long-term care. Right now, there's been not quite 100,000 policies sold, about 91,000 policies sold, and 68,000 active New York State policies. Of those policies, only 3,400 have received insurance benefits. So people have bought the policy, 68,000 are active, used the policy, and only 240 people since 1993 have actually hit Medicaid. So 68,000, 91,000 sold, 3,400 and see some insurance benefit. 240 people actually hit Medicaid, and when they hit Medicaid, and what people have used it for is nursing home 33%, outside nursing home 67%. The vast majority of it, people want to receive care outside the institution. We see from our partnership experience that 58% of the policies purchased by females, which is, I would assume that number would be higher because the females are the one that actually do plan in this country, who work on the family planning. 75% purchased by married individuals. Average age is purchased at 62, and that has gone down over time. Only 18% of policies lapse by 10 years. Now these are expensive policies, so an 18% lapse rate, in my mind, isn't that bad. We like no lapse rate if we could have it, but 18% of the policies lapse. Average date of first claim is 80. So people buy it at 62, and if they need to use it, which a vast majority of people don't actually, but they use it at 81. Average time between first claim and death of 2 years. So that's the partnership experience for New York State. What's the lessons from the partnership? We have private long-term care insurance. It's a valuable benefit. It helps offset Medicaid costs for the state. Because as long as people use private insurance, they don't hit the Medicaid system. So it's a valuable benefit. The partnership works. It actually provides that comfort at the end. You'll be able to get on Medicaid without asset protection, but a very small number of people actually hit the Medicaid system. And we think middle income households can benefit greatly, but the more affluent ones are actually who buy it. So in middle income in New York is a classic debate. In downstate, middle income is some high level of income and high level housing. Middle income upstate is a little bit different, but we think that the middle income actually, the people who make between $50,000 in their retirement income to $100,000, $120,000 in retirement income, that's income they get after they retire, can benefit from private long-term care insurance. But these things are expensive. They're expensive because the system is expensive. So cost is a deterrent. The other thing that's a deterrent is the big old denial. People think in this country, in this world, not necessarily in the world, but in this country, that they're never going to need long-term care. There's this invincibility about, I'll never need long-term care. And that is starting to change, though. That's starting to change as the baby boomers' parents age. And people see the stories and the experience of helping their parents in the long-term care system. So we have lots of lessons and lots more to learn. This year, we had a huge, big budget debate, huge battle on the budget, but we actually were able to slip in this long-term care financing demonstration. It passed the legislature. It was proposed by the governor, passed the legislature, had only like a couple different questions in the one briefing we did. And this allows people to plan for long-term care, to finance part of their care, for people who are uninsurable, is what really this is at. People who can't get long-term care insurance, medically underwriting, or just aren't eligible or can't afford it. It allows the state to work with individuals to make private contributions towards their long-term care costs. It's another avenue, and we've been debating it for a long time as a deferred program that was started in 1997 on the Long-Term Care Task Force, and then more recently it's been debated as part of the Long-Term Care Compact, which the Bar Association has been pushing for a number of years. So we decided in the executive branch to stop talking to actually try to put something in law and limit it to 5,000 persons. So we did that. We're working on implementing that proposal. This last bullet is very important, as it requires approval from the federal government, which is sometimes very hard to get for things that are new and unique and different. But the long-term care financing demonstration was enacted. It is law. We don't need to talk about it. We need to talk about how to implement it as time goes on. And then I put this slide up to talk about, I really talk about some of the ideas that we had pushed in the last couple of years, mostly since 2007, about ways that we can move forward on this debate. Some of these are just ideas and a lot more work. Other ones just trying to get the conversation going. So first is implement the financing demonstration program, establish an individual long-term care reserve account for the state tax benefit and limited asset protection, kind of like the partnership, a partnership for people who are uninsurable. These probably work together. Then we got into a whole bunch of conversations about how to increase the long-term care insurance marketplace. Partnership is just a piece of the marketplace. So we talked about a proposal to allow New York State or local government employees to use their sick leave time to purchase long-term care insurance. They can do that for health insurance and retirement. Why not long-term care insurance? This one is another controversial proposal to allow open enrollment at certain increments in New York State local government employees. Right now, when you join the state workforce, you have an open enrollment period where you can buy the New York State sanctioned long-term care insurance policy without underwriting. So most people don't because they're, except that we're hiring anyone in New York State, they are younger, and they don't have the ability to do that or don't think they'll ever need it. So how about we open this enrollment at 50? When they turn 50, you get a 3-month window. Or when you turn, or after 10 years of employment, or 20 years of employment. How about we open that window again? Now that should scare the insurance companies because then you're having an open enrollment for a period when you're not allowed medical underwriting. So you'll get all sorts of different risk factors when you do that open enrollment. But we talked about that a lot actually in the OA session, never proposed that we talked about it. In the partnership plan, one of the other issues is the income. We had actually provision enacted in 07 which increased the income protection under the partnership plan. The basic partnership is just full asset protection, but there is some income protection. We doubled it actually in 08. How about we increase that even more? How about we make even more of an incentive for people to buy partnership plans by increasing income? And then this is another one which we've been playing with for a number of years, is saying for the people who are uninsurable, how about we set up a state-administered insurance pool? So set up a backstop for the insurance companies to actually increase medical underwriting for the marginally uninsurable, people that really can't get insurance without a state subsidy. This has been talked about for probably 15 years, 10 or 15 years in different forms, but never actually advanced and been enacted. The other thing that we have in long-term care, and I'll step back into the system a little bit, is the uniform assessment tool, which is a provision that we've been talking about for a couple of years and actually started to implement. In long-term care, when you go to all those different programs, there's all sorts of different forms that you have to fill out, different assessment tools. The PRI, the MDS, I could go on, different assessment tools, which makes really it's hard to do data analysis or hard to do policy development because we really can't get a handle about what the true needs are for people in long-term care. So we strongly feel in the Office of Long-Term Care that you need a uniform assessment tool that's independent, objective, and consistent, and it is updated periodically so that we get a sense of what people really need. The other issue, so the assessment tool is important no matter what you do in long-term care. That's important. And then we've been talking about reverse mortgages or home equity conversion or some other way to unlock the massive home equity we have in the state to support long-term care. This has kind of been a little bit of a pig in the poke because it's not the answer. It could be part of an answer for long-term care. So I'll just wrap up quickly. Final thoughts. Rising costs of long-term care is a huge challenge and getting bigger as the baby boom generation ages. I happen to be lucky enough to be born in the last year of the baby boom, so I'll see the end of whatever havoc the baby boom wreaks on the government reform system. We continue to default to Medicaid as the answer. The country and New York State always defaults to Medicaid. If you were back in 1965 and they said you set up a long-term care system, you would never set it up as Medicaid. You would set it up as something else. But because of the lack of alternatives, we often set up as Medicaid. And then you have the constant, and you'll see a lot of debate this session about this. Medicaid's on a cost growth way that we need to. I'm not going to use all the bend the curve or kind of all the things that they say, but the taxpayers are unable to support the cost growth. And long-term care is big about that. It's a big part of that. So federal efforts have been controversial. I don't know if you all remember 1988 when Dan Rostenkowski was accosted by a bunch of senior citizens around his car for his support of the Medicare Catastrophic Coverage Act, and that was really about introducing the concept of seniors paying, higher income seniors actually paying for more of their Medicare, and a drug benefit. That was repealed within a year after that episode. Now it seems crazy because we have Part D, but that was really controversial at that point. And then Courtney mentioned the Class Act. I was going to talk about how Class Act was just enacted, and then you have the President's Commission within less than 9 months saying repeal it. So it's another thing about Class Act, as Courtney mentioned, is a passive part of healthcare reform, was not the focus of healthcare reform, was kind of added on at the end, thanks to advocacy by the Nonprofit Nursing Association and others to try to get something going in long-term care. But already they're talking about repealing it. So my other fun thought I'd like to leave with you is that long-term care is such an issue it needs to be part of the election campaign. There was a famous poster that I was trying to find this morning in my basement, couldn't find it, but the ARP did in 1988 when the presidential election was going full tilt. It says a picture of a grandfather in a wheelchair and a son standing over him, and it says, next time someone asks you for a vote, ask them what they're going to do about long-term care. And I really honestly feel that the issues are so big and society is so against really dealing with the dial is so big that a long-term care solution needs to be part of a presidential campaign. That's